Okay, I'm just going to give you a little bit of an overview of my hip replacement and recovery. I'm about 10 months into it now. I had it done in July 2012, and that was on the back of 3 cartilage operations. I'd had continuing pain in my knee and had operations in Thailand, and the doctors had done little microfractures in the bone to promote cartilage growth, and on the last stop it just simply wasn't working. I was still in pain with my knee, and I also mentioned to the doctor that my hips were aching, so he sent me for an x-ray and had a look at it, and he realised, he drew a line from my ankle to my hip and realised my knee joint was out by about 1.5 inches, and it was caused by calcification around the neck of the hip on the leg and where the ball and socket was. And this was causing restrictions in movement, and he said general wear and tear, and that there was also a little bit of arthritis there. So I asked him what could be done, and he said to me, you can break my leg and put a plate in to move the knee back into position. It would solve the knee problem. But I thought that was a little bit drastic because I'm only 42 and I didn't want to stop playing sport. And he said literally that was the end of me running. I've got to pretend that I'm old and now actually take a more sedate life and take up golf or something like that. So I wasn't happy with that. So I went to see a surgeon in the UK, Professor Max Fehily, who was a renowned hip surgeon, who referred me to see Dr. David Sands Johnson, who's a knee surgeon. So I isolate the problem, and I wanted a second opinion, and I wasn't happy. All right, I'd slowed down at rugby a little bit, and a lot of the boys were giving me a bit of stick for that, but just wanted to make sure I was getting the right opinion. So after a few scans and consultations with those guys, they agreed, and they said that the technique that the Thai doctor wanted to use wasn't incorrect, it was just a little bit drastic, and they said there's other things they can do, like compartmental replacement of the knee. But they suggested I use a medial offloader and do my level best to put off any form of operation on my hip, but both of them were in agreement that if I cleaned the hip joint out, then that would isolate the knee problem and see where the potential issue was. So I booked in. A couple of things led to me delaying the operation, but I was told to take pain medication. I did, but eventually it got to a point where I couldn't walk around the shopping mall and without having pain, having to rest on a night time. So I knew I had to get something done. I originally was going to get an arthroscopy done, and that was just going to clean the joint out, and I was going to be back on form. As I turned up back in the UK to see Max Fehily, shocked me a little bit at 10 o'clock in the morning when I was supposed to be under the knife at 2, and said he wasn't happy with his original diagnosis and said, would I consider a hip replacement? So at 42, I was a bit shocked about that and thought, well, maybe not. Maybe I need to reconsider. And he said to me, well, to be honest, if you have a hip arthroscopy, the recovery time is going to be the same as a replacement. So in his opinion, I would have been back in a year to get it done. Why bother? Why bother? Doing the same thing twice and having all of that pain issue. So at 2 o'clock, I went under the knife, and pretty steady operation, to be honest. I wasn't particularly nervous. I hadn't really had time to think about it because of work and various other things. So I was given a little shot to make me drowsy, and I had probably equivalent to an epidural, a spinal block in my spine. And I woke up a couple of hours later. I came around a couple of hours later in the theatre, and the doctor said, there you go, that's it, you're done. So I was quite surprised. I was back on the ward and talking to the kids and Debbie, my wife, within a few hours, as if nothing had happened. And then I think that's where the difference is, because as I'm not your average hip replacement patient, generally it's people who are in their 60s. I had a mindset that, I need to get this right. I needed to get back on my feet. So the first night, I've got to admit, although I came around, I was watching TV, one thing I can't do is sit in bed and just simply stagnate. So I watched TV. I was given exercises to do by the physio in the bed, so I was powering those out. And basically the next morning, I'd been told because of the spinal block I had to go to the bathroom, so I did manage that during the night. And that was a bit of a struggle. I wasn't allowed to get out of the bed, but because of the spinal block, it seemed as though it was difficult to urinate, but I managed it. And in the morning, the physio came, gave me exercises, did those, was able to stand up and do basic movement exercises and not too strenuous. Saw the doc that afternoon, and he said to me, right, well, the minute you can walk down the corridor and show that you can competently climb up the stairs, then you can leave. So that day I was walking down the corridor with my crutches and up and down the stairs a few times, ready for the next morning when the doc came back and said, okay, you can go. So I did it, and I booked in for intensive physio and rehab with Doug at Harrison Ross in Manchester. And then the main thing what I wanted to do is really exercise it and get back on my feet. So Doc was happy, Doug was happy. I spent 3 times a week at their centre going through various rehabilitation options. A lot of it was just relieving the tension in my back, muscular pain, and building up core body exercises and strengthening the hip and the leg as well as the other leg, and getting everything moving again and rebuilding that strength. I was fortunate enough to do hydrotherapy in the pool, and there was a pool very close to it, so I could walk up and down in the pool, which took the weight off my body, and that really did help. One of the things they did have at the centre was an Alter G, and that's an anti-gravity treadmill. So you literally put a wetsuit on the bottom and it fills with air and takes your weight. So I was on that most days, and after the second week, 2 weeks after the operation, I was running. That surprised me, surprised everybody. But I think that was one of the main things. I overcooked it the first day. I'm ex-military, so I did in my mind, right, okay, I can do this. And I ran, and I did 30 minutes, and I was limping. I was running with a limp, And the physio saw that, realised I'd sort of overcooked it a little bit, but I was back the next day. However, I'd gone out with the kids. I thought, okay, I'm going to ditch my crutches, or I'll use one crutch. And I went for a walk, and unfortunately, we didn't know the area we were staying in Bolton, so I got lost, and so I spent 2.5 hours walking around the Dales. So I came back, and that was painful, I've got to admit, because I'd overdone it myself. And I went back in the next day, just stepped it back a bit, but I was on the set path. I knew that I was able to run or jog very slowly, and the pain management wasn't that bad. I stopped most of the anti-inflammatory stuff, and got back on track. And the main difficulties I found in that 2 weeks is, you are supposed to lay down. You're not supposed to move in bed in case you flip, and you can pop the joint out. When you go into the bathroom, you have to have a raised seat. So I've got to admit, I was very, very careful, and I took care of it and did exactly as the doctor and the physio said. But when I got to the point where I could start to exercise, then I really put effort into it. And every day that I was at the physio, I'd also go to the gym to keep my own fitness up, and also do a little bit of strengthening where so my other bodily parts were working a little bit normally. So that for me, it showed the doctors something. They were really amazed. I spent 5 weeks in Bolton, and amazed at the recovery. They'd never seen somebody recover so quick, but they could see the determination that I had to do it. Now, one of the big things for them is that they'd seen that rather than push hip replacements out for people who were in need of them and do it when they're 60 or 70, they could see if they do it when you're younger, that you can actually recover, because you've got the physical strength and the willpower, and you're not just going to sit down on your backside and wait until, okay, I've got 6 weeks off work now, I'm going to do nothing. My incentive was I needed to get back to work. I run my own business. So they've changed their thinking slightly into, well, why wait for people if they're in pain and they need a replacement? Let's get it done. So I can safely say now, 11 months later, I'm fine, I'm back to normal. A little bit of pain in my knee, but I'm not doing too much. I'm riding motocross bikes. I'm not back playing rugby. I've given that one a miss, but doing okay. I was, after about 5 weeks in Hull, I was straight back into doing some kettlebell classes, which I enjoyed. A little bit difficult because of the restricted movement, but all in all, I would say if you're nervous or considering hip surgery because of pain, and the pain is too much, then go and get it done. There's no point waiting. I think as I've done, I've realised it's a lot more beneficial to be able to be mobile and doing things with my kids again, as opposed to be laid up in bed saying, ouch, my leg hurts. All right, hope it helps.